Okay, here we are. I am back. So the other screen wouldn't allow me to pull in the practice question, so I had to stop and come back. But we're back. So again, good morning. I'm Bridget Montgomery. I'm a licensed clinical social worker, and I am coming on this morning to just go over a practice question and trying to help you guys as you go back to your studying process and do, and try to prepare for this exam. I know for many of you, this has been a very difficult and trying process because it can be very, very confusing for many of us because we get so many different, so much information in regards to what to expect when it comes to the ASWB. And I think somehow we get misled is because one of the things that we're not doing is that we're not following up and checking and getting the information for ourselves. And so it's really important for me to make sure that I let all of my students know, or anyone that I may be assisting, to make sure you go to www.aswb.org for yourself and gather all the information that you need to know as it pertains to the exam. There is a workbook. They are not paying me for saying this, but there is a book that they actually offer and that they sell that has so much information in that workbook that if you take time out to kind of read through it and digest it, then you'll have a good understanding of how the exam is set up, the design of the questions, and what to expect when it comes to taking the exam. I myself, I do write practice questions. I share practice questions, but I'm going to be 100% honest. My questions are nowhere near in comparison to the actual ASWB exam. And why is that? Because my questions aren't tested, assessed, and gone through a rigorous process, much like the ASWB exam questions are. And I can say that about my questions and every other question out there that is not directly from the ASWB website. If you did not purchase those questions from the aswb.org, then all the other questions are questions that have been created and developed by other social workers or other professionals that have some insight into the programming and some insight and some understanding and some knowledge into test taking strategies, and they're just sharing that with you guys. So don't get yourself really worked up and really frustrated if you're not able to answer these questions in a way that you believe that you should. It's okay. What you want to take away from your studying process is really get into the habit of thinking critically and analytically and learning how to process and reason, given explanations and rationale for every answer that you come up with, for every choice that you select, whether it's the choice that's answering the question or it's the choice that is not answering the question. You should be able to give a reasonable explanation as to why this is not the best choice and why this one is the best choice. Once you get into the habit of doing that, looking at these questions critically, your perspective will begin to change. How you're viewing the questions will then begin to change, and your confident level when it comes time for taking this exam will increase. Okay, so that's my prelude, that's my introduction. And for those of you who are up this early in the morning with me and ready for the practice question, let's go ahead and get into it. Okay, I got my coffee here too, so I'm gonna take a little sip. And I'm gonna go ahead and introduce the question. Hopefully you guys can see the question. I tried to make it bigger this time. Usually it's a little bit smaller. The font is a little bit smaller because I like to have room to be able to write and do explanations as we're working together. So here we go. Let's see what we got here. Okay, so the question reads, a woman was referred by her primary care doctor to see a social worker for psychotherapy. She and her husband has been trying to conceive a child with multiple failed attempts. The overall process has taken an emotional toll on the woman, so she's seeking help. During the initial consultation session with the social worker learns that the client's husband is her ex-fiance. What is the best way for the social worker to handle this situation? A, discuss the conflict of interest with the client and provide her with a list of social workers, other social worker, psychotherapists that she can see for therapy. B, contact a colleague to discuss details of the case and get let me fix that, and get some consultative or supervisory support. C, discuss the session and explain that you will not be able to treat her at this time as she never got over the breakup. Or D, explore how the client will feel about working with the social worker given the nature of the situation. Okay, so the first thing that I always suggest that you guys do, or what would be helpful when trying to process and answer these questions. If you can hear me, just type yes really quickly for me, because I want to make sure you can hear me before I go any further. So if you're with me and you're able to hear me, please type yes in the comment section. And I'll give you guys a second to do that. Okay, great. All right, great. So let's move on. All right, so the first thing that I always require that you guys do before answering the question is kind of look at it holistically. And I had some people say, well, that's a whole lot. Will I have time to do it? Yes, you will have time to do it, because if you're practicing this procedure prior to taking the exam, it gets easier. It gets, it becomes a little bit more simple, and you're able to kind of process and reason in this way. So if we're looking at the question holistically, what kind of situation do we have going on here? According to the vignette, okay, according to what we've read, so I'm gonna pull this out of the way just for a second. I promise you guys, I'll be understanding this question. What do you see? All right, we have a woman who was referred by her primary care doctor to see a social worker for psychotherapy. She and her husband has been trying to conceive a child with multiple failed attempts. The overall process has taken an emotional toll on the woman, so she is seeking help. During the initial consultation with the social worker learns that the client husband is her ex-fiance. What's the best way for the social worker to handle this situation? So first of all, what is actually going on here? We got a few things, and I want to dialogue with you guys. I want to see what you guys are saying to me. When you read this vignette, what do you see going on here? What content area? I'm going to ask you that question. What content area is being addressed here or assessed? So what I mean by that, okay, so we've all been looking at our KSAs, right? The knowledge, skill, ability, that list. It covers a whole lot of content. It breaks it down into about 4 or 5 different subject areas, and then under that, specific topic areas, right? So when we look at this and we read through this, what content area is this covering? What is it assessing? What is this question expecting we have some knowledge and some understanding of before we can even answer the question? I hope I asked that question correctly. I hope you guys understand what I'm asking of you. So I'm looking for you guys to tell me what content area is being assessed here. All right. Somebody said in the initial visit, ethics. Okay, great. I saw one in there. I see some ethics, right? So right now we're looking at the content area, pretty much ethics, right? So we got a situation going on here. And so we need to be able to retrieve our knowledge and our understanding of what we know about ethics, when we're dealing with ethics, when we're dealing with a situation that might have an ethical dilemma or an ethical connotation attached to it. Okay, so this is a question that's dealing with ethics. All right, so we do have a woman. All right, age is not specified, and that's okay. But we know that she was referred to us by her primary care physician. All right, so this client came to us because she was referred to us. All right. And so keep that in mind. Okay. It talks about her and her husband and something that they've been trying to do. So they've been trying to conceive a child and they had multiple failed attempts. All right. So that gave us some background information, a backdrop. So we got a little bit of information on one of the reasons why she's coming into therapy, to receive therapy. And we also know that it has taken an emotional toll on her. And so this is why she's seeking help. So coming into therapy to get some support, because after trying to conceive a child, she and her husband haven't been able to do so. It's been taking an emotional toll on her. Now, all that information is important, but is it important for what it is that the actual question is asking us to do? I don't know. Let's move a little bit further. Now, during the initial consultation session, I'm going to highlight that because that is particularly important. Anytime you see a question that is going to specify a phase of treatment that you're in, please pay attention to that. And the reason why I say pay attention to that is simply because it's giving you something, it's giving you information that it wants you to pay attention to and to be aware of. Now, when you're dealing with a client in the initial phase of treatment, the way you approach the client, the way you handle the situation, the technique, skill, therapeutic interventions that you use is going to be very different than the technique, skill, and therapeutic intervention that you use for an established client. Okay, so this is a very new client. And so knowing that this is a new client and you're actually in a consultative session, it doesn't even talk about you're doing an intake. This is consultation. So she's coming in and pretty much kind of sharing what her needs are, what her concerns are, and she's looking for therapy. So pay attention to that. This isn't even a session that has taken place yet, right? She's not even going through the intake process. And so pay attention to that language. During the initial consultation session with the social worker learns something. The social worker learns that the client's ex-fiance, that the social worker learns that the client's husband is her ex-fiance. Let me ask you guys something. Is this significant information? Yes or no? Now, again, something that I need to highlight and I need you all to understand is that when we are trying to answer these questions and really come up with our answer or the best answer for the particular scenario, you have to understand where you are in the phase of treatment. And this is the beginning, a new client, right? We also have to know who the person it is that you are dealing with or treating, or the person with the problem, issue, or concern, right? And so we need to know that, but we also need to, and this is the most important thing too, we need to know what is the actual problem. Now, before I move forward, I'm going to ask you guys, when you read this vignette, what do you identify as the problem that we need to be focused on to deal with the situation, to deal with the question, to answer the question? What is the problem in this vignette? I'll give you a minute to do that. What do we see as the actual problem that we need to be focused on? The problem that we need to be addressing in this here vignette? So what do we see as the problem I'm seeing dual relationship. I'm seeing the client and her problem. The client's husband is the ex-fiance of the social worker. Very good. Dual relationship. Okay, so I'm seeing a lot of different things going on in here, and I see you guys are answering in a lot of different ways. And the way you guys are actually answering, I'm not going to say that it's bad. However, this is what I am going to say, and this is what I'm going to highly recommend. Stay focused only on what's written. Do not add anything. Do not take anything away. Do not create your own language for what's going on, but stay focused and specific to what's right here in this vignette. So just looking at this particular vignette, what sentence can we identify in this passage as being the problem sentence, the focus, where we need to direct our attention to highlight what's going on? So I'm going to give you guys another opportunity to go through and try to identify the problem in this situation, what we need to address as the social worker in the immediate, in the present. So I'm going to read it again. A woman was referred by her primary care doctor to see a social worker for psychotherapy. She and her husband has been trying to conceive a child with multiple failed attempts. The overall process has taken an emotional toll on the woman, so she is seeking help. During the initial consultation session with the social worker learns that the client's husband is her ex-fiance. What is the best way for the social worker to handle this situation? Okay, so again, what is the problem in that vignette? Using the words in the vignette, not creating your own, not coming up with your own ideal of what you think the situation is, but using what has been stated already. What do you see as the identified problem that we need to address? All right. Michael said, what's written in red? Michael, can you see it, or are you just stating that what's written in red? Because I got red and purple, and that purple can look like red. So guys, if you don't mind, it's okay. Go ahead. We got time. Well, I got a little bit of time. I don't have to be to piano until noontime. So I got a little bit of time to walk through this with you. To my assumption, Damaris, I'm going to tell you to delete that word assumption. We are not going to use the word assuming any kind of assumptions, and we will not allow that to direct our focus or our attention on answering any practice questions or dealing with any clients in particular at all. We will not assume. So reword that for me, sis. Social worker learns husband is ex-fiance. Good, Angela. The husband is the ex-fiance. Very good, Amy. Client needs psychotherapy is help. The social worker learned that the client has her ex-fiance. Okay, good. So I'm seeing some responses pour in. So again, let me show you how to point this out. Now, most of us would think that the issue is the client needs psychotherapy. No, that is not the issue. That is information that has been given to us to help alert us to why she's coming in. She does need psychotherapy. She was referred by the doctor. It's given us a little bit of backdrop that she and her husband had tried to conceive a child with multiple failed attempts, and that process is taking a toll on her. So we know why she's coming in. So that highlighted area right there is pretty much just telling us why she came in. So we got that. Let's not lose it. But is that the primary focus? No. So here's what's happening. During that initial consultation, so she's sitting in front of you, Michael. She's sitting right there, Angela. She's sitting with you, Amy, and she says to you, you know, what's going on. She's giving you all the information, and she tells you, you know, about her husband and how they've been trying to conceive, and she gives you her husband's name. And to your surprise, you realize that that name drop was actually your ex-fiance. There's the problem. The social worker learns that the client is her ex-fiance. Now notice, we said this after we read the entire vignette, we noticed that this is addressing some kind of ethical issue. And how do we know that? We knew that because our prior knowledge, we've been studying for so long, we've been practicing in the field for so long, and we can pretty much feel through our gut when we come upon a situation that's dealing with ethics, right? We know, even though we may not have the material right in front of us, you know, because we study, because we internalize the information and not memorize the information, we were familiar with some of the things that was happening in this vignette, and we were able to say, this is something's going on here. This is dealing with some ethical issues, right? And so the problem that we need to zero in on and focus on is the social worker learns that that the client's husband is actually her ex-fiance. Now, this last sentence, okay, most people, you know, sometimes we kind of just skim through that and read through it real quick. I call this the instruction, right? That last sentence right there, please pay attention to it. Why? Because it is your direction. It is your instruction. It is the question that is asking you, what should you do, or what is your follow-up, or whatever. So here it's asking us, or it's saying to us, what is the best way for the social worker to handle the situation? Well, what's the situation? I could call it a problem. I could call it a situation. I could call it a concern. I could call it a lot of different things. So don't get caught up on just the style of wording. Understand that words have multiple meanings, right? And so that situation can translate into, what is the actual problem? What's going on here? What do we need to do? How should we intervene? Right? And so it could translate into a lot of different things. So we're going to identify the problem as the social worker learns that the client's husband is her ex-fiance. That's your issue. That's your concern. That's your focus. That's your problem. Any questions? Are we understanding this so far? Before I move on, I just want to pause a little bit, check over in the comment section and see if you guys have any questions so far. Now, we got a lot of information here. We know we're dealing with an ethical situation. We know that this is a very new client, is not even an established client, and we're in the beginning phase of treatment. We need to keep that in mind. We know we're focusing on the woman, the wife, right? We know that she's the one that's in front of us, and she's the one that's coming to us and presenting us with these concerns, these issues, and she's the one who delivered the situation. She's the one that said to us what she said to us, that helped us to identify, okay, here's the situation. Here's what I need to be focusing on first. Before I can do anything, I need to focus on this first, right? Any questions so far? Yes. Okay. So nobody has any questions so far, so it's okay for me to move on? Just say yes, okay to move on. All right, Marilyn said no, very good. All right, so given all of that, right, we said a lot and we did a lot, right? Let me ask you guys this, and this is the interactive part, so I'm gonna need you guys to talk back to me, okay? How would you, without even seeing the answer choices, now, keep in mind, there's a plethora of things that we can do. We're all, you know, we're all social workers here. We all deal with various situations in various different ways. All right. And so there is no one particular way of following up or doing what you would do first. And so this particular question is not asking what you do first or whatever, but it's just saying what's the best way for the social worker to handle the situation. What we will find on the exam, and most of you already know that because you've already taken the exam, and for those of you who have not taken the exam, what we're going to find is 4 choices. Okay, we are not looking for the correct answer. We're never looking for the correct answer because there's multiple ways we can handle a situation, but we are looking for the best answer. And we're looking for the best answer that's going to tie into the problem and answer the last sentence, and answer that last sentence that I actually call the instruction. So we're looking for the best answer, not the correct. We're looking for the best answer that's going to tie into the problem which is the social worker learns that the client's husband is her ex-fiance, and it adequately answers the question, what is the best way for the social worker to handle the situation? So now I'm leaving this up to you. I'm gonna give you guys a minute right over in the comment section what you would do. How would you follow up? What's the best way for you to follow up in this situation? And I know I haven't showed you the answer responses yet. I just want you to see that you do have an understanding of what it is that you do. And I want you to write that down so we could dialogue about it. So Jeremy said, realize I can't help someone with the advice or treatment whom I was that close to. It is a conflict of interest. So you're telling me, Jeremy, what you would realize, and that's important. You need to realize, but this is a question that's asking for an action. So after you realize, Jeremy, what you won't do, which is excellent, what is your action? What will you do? How will you follow up? How are you going to handle that situation? Rosa said, refer out. Okay. Sharon is saying, my gut feeling, because I will be in my emotions, is to transfer her to a different social worker. However, I'm looking at it from an organizational policy perspective. I would consult my supervisor. Okay. And then Suni said, talk to the supervisor and refer out. Very good. Now, Sierra said, there we go. Conflict of interest was the term I was looking for. Oh, okay. Amy is saying consult with supervisor. Okay. All right. So very good. I'm loving these responses. Refer to another social worker, supervision, and refer out. Michael is saying good responses. Sherry is saying discuss the dual relationship with the client and offer to refer her to another therapist. Very good, Sherry. Demary is saying, talk to the supervisor. All right. So I'm saying I'm getting two things, and which is great, right? I'm getting talk to your supervisor first, get some consultation, and then refer out, right? Now, in this situation, that is excellent, right? I'm loving how you guys are coming up with your answer. Some of you guys are probably working with in agencies. And so, you know, you're not just going to go ahead and refer out to a client. And some of you are probably in private practice or whatever. And, you know, your thought is to refer out, or some of you are just case managers or whatever the case may be. All right. So we're getting to the point of refer out or consult with our supervisor before making a decision. And I like, let me find where Sherry, was it? Sharon Jackson. I love how she coined that, my gut feeling. I will be in my emotions. We got to be honest with ourselves. And transfer her to a different social worker. However, I'm looking at it from an organizational policy perspective, and I would consult with my supervisor first. Okay. Jeremy, I like how you said that, realize I can't help with someone with advice or treatment whom I was that close to. And so it's a conflict of interest. And so we have to first look at the situation in its totality and figure out what's going on here and what is the best way to answer that and move through it. So you guys are doing brilliantly. I'm loving this. All right. I'm getting really excited. I'm sorry, I'm a social work geek. All right. So I'm going to take away all that stuff that we've already answered, right? I didn't want you guys to see that yet, but I think I messed up already and put this here. So let's look at our choices. A, discuss the conflict of interest with the client and provide her with a list of other social work psychotherapists that she can see for therapy. B, contact a colleague to discuss details of the case and get some consultative or supervisory support. C, discontinue the session and explain that you will not be able to treat her at this time as she never got over the breakup. Or D, explore how the client would feel about working with the social worker given the nature of their situation. I'm going to go ahead and take a sip of my coffee real quick while you guys select A, B, C, or D. Don't just say A, B, C, or D without your reason why you chose the answer. Please give me your answer choice and your reason in the comment section. Give me your answer choice and your reason, your rationale in the comment section. So say A, because such and such and such, or B, because such and such, such. Support your answer. Be confident in what it is that you know. Stand by your answer choice and give your reason for why this answer is the best answer choice and why it's relevant. Okay, you can do this. So Jeremy, go back and give me a reason why you select A. Michael, you got jokes, dude. You can still give me a choice. Skylar is saying A for dual relationship. Michael, you might have saw A. Don't just choose A because you saw A. Support why you saw A. Just because you saw A, give me something else. Give me a rationale behind it. Sharon Button's code of ethics is not an answer choice unless you just checking in. I apologize. I forgot some people may be just checking in. I didn't mean to say guys, ladies and gentlemen may be checking in at different phases. All right, Sherry Wright, A, my rationale is that this is definitely a dual relationship. I am referring her to another social worker would be the benefit of the client. All right, Marilyn, A, don't want client to have bad experiences to not want to come back for therapy. So be honest to explain why providing lists other therapists, but having her best interest. Okay, very good. Deborah, A, because the problem sentence is about the social worker, but the client. Deborah, go back and give me something different, mama. Stand by your rationale. Don't take the easy way out. Support it. Stand on it and give the reason why you're selecting A. Look at the whole vignette in its totality. Think it through. Look at everything that's highlighted and support your answer. Sierra, because B has to do with confidentiality. C is too unethical. D is not about feelings, knowing that the client is seeking help. All right, but why A? Give me the A, Sierra. Talitha, A, because it's a conflict of interest and the client should know that. Providing a referral is professional and in the client's best interest. Very good, Talitha. All right, you guys got me excited. I got my energy, I got my mojo, I got my coffee going. You guys are popping out these answers. I'm excited about what's going on here. Michael, if you do not give me another answer, I'm gonna stalk you and I'm gonna harass you. All right, Michael, there you go. I thought B from organizational, thought giving supervisors reason why refer out. Rosa, the rest don't answer the question. Rosa, try it again, mama. That's not, listen, we're social workers. Let me put this out there. We are social workers. We are on the battlefield day in, day out. Okay. You're not going to be given choice A, B, C, and D to choose from when you're dealing with clients. You're going to be given a plethora of resources, situations, ideas, and ways to creatively work with this particular client to help them deal with their situations. And you have to be able to adequately explain to your clients why it is that we're doing, or give them a list of options that they can choose from. And because they have a right to self-determination, when they choose what it is that they want to do, you have to be able to support that, educate them, and be able to communicate back to them what it is that we're doing and why. Okay, you're the expert. Okay, they're coming to you because they trust you. They're coming to you because they believe that you have the knowledge, skill, and ability to help them get through the situations that they're dealing with that's giving them distress, okay? And it's not enough for you to say, it's not enough for me to say, well, okay, that sounds good, so let's give it a try. You are the expert. You are the licensed professional. You are the licensed social worker. You are the licensed clinical social worker. You are the expert. You're not going to go to a doctor and the doctor is, treating you, and then you come out and he just says, after he, looked at all your results and just said, yeah, you are sick. I'm sorry. What you said that you was feeling, you are feeling it. So here, go ahead and get this medicine, and I'll see you later. You came to that doctor because you trust him. You came to see the doctor because you need his expert opinion. You came to see the doctor because you need a thorough understanding of what you're dealing with and what you're going through and how to deal with it. You need his help, his guidance, her support, the doctor's, understanding of your symptoms. You need that information. So I said all of that to say, stand by your answer, support your response, and talk to me. All right. Skylar Mitchell, thanks for pointing out. It says nothing about supervisory. Great point. Sune, yep, what I was trying to say, but it was not the best explanation. Okay, Skylar, disregard, sorry. Okay, I'm backing up. All right, Demara. A is the best option because she is explaining to the client why the therapeutic relationship may not work. And she also states the client is given a list of options. All right. Good job, guys. So most of you already saw the answer, and I pulled that up by accident, but check this out. All right. One of the things that I highlighted, I said this is the initial consultation, right? So when we're dealing with a consultation, we haven't even accepted this individual as our client yet. So this person is not even our client yet, right? She's coming in for consultation. She's coming in to get an understanding as to whether or not we can work with her, whether or not we are a good fit, whether or not you will be able to take her on as a client. So with that being said, we can disregard anything that's checking in with our supervisor or really getting consultation at this particular point. All right. So I'm not saying that B is a wrong answer, but I'm going to say no for now because she's not even a client yet. So we do not need to consult or get supervision or guidance from anyone at this time. She's not your client. You have not taken her on, so we don't need to do that. I'm going to say discontinue the session and explain that you will not be able to treat her at this time as she never got over the breakup. Well, yeah, no, I mean, you know, are we telling her this? We can't treat her because I'm mad at your husband. I'm still going through some things. My heart is still hurting. That's unprofessional, right? This is a very unprofessional way in which to manage and handle a case. Okay, so that's just unprofessional and that's just tacky. D, explore how the client would feel about working with the social worker given the nature of the situation. Somebody pointed out already that, I got to be real with myself and, how that might be and da, 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 da. I don't think this is all the way bad. However, if you end up taking on the client, what would end up happening is that we will find ourselves in a situation where there's a dual relationship. Unfortunately, you know too much about her husband that would put you a situation where you wouldn't be able to adequately address her needs. Now, I get it. You say, well, you got to put your feelings to the side and all that stuff, but she can relay stuff to you because you got a backdrop. You know who he is. You've had experiences with him before. Y'all were on the road to getting married. All these different things is just ugly, is icky. There's a lot of different situations that you might find yourself in that could be really uncomfortable. So trying to proceed with this particular client would not be in the client's best interest, and it's not in the best interest of you. You don't know what kind of transference issues that may come up. There's a lot of different things that can go wrong with taking on this client. So this is a no, right? Because of the potential, how you spell potential, that arise for a dual relationship, right? There could be countertransference going on, right? And you don't know that until you actually get into the throes of the treatment. Am I making sense so far? Is all this kind of coming through? Now, we did see that the answer was A, but why. You know, discuss the conflict of interest with the client and provide her with a list of other social work psychotherapists that she can see for therapy, right? So what we learn is that ethically, the social worker should discuss the impact of the conflict of interest with the client and refer her to another social worker, as therapy has not started yet. So she's not actually your client, right? She's not someone that you're actually seeing or treating or that you've taken on. And so instead of, offering, a dangerous situation to occur, the best thing that you can do for this client first and for yourself as a therapist is to provide her with a list of alternatives, other therapists that she can quite possibly check in with and research for herself and go out to see and see if they can take her on as a client. You taking her on as a client is just, introducing other problems to arise as you continue to move forward in the treatment process. Because, you're in the beginning phases, she's not a client, you haven't even established a relationship, you were just at the phase of just interviewing, getting some basic information to see if she's a potential client, it is quite all right to let her know that you cannot take her on as a client and give her some options, list of other therapists that she can choose from and make a referral for her to go and see someone else. Okay. Here, I also have some other information, just, giving you some information on what understand the conflict of interest. So a conflict of interest occurs when a client, occurs when a social worker services to or a relationship with a client is compromised or might be compromised because of decisions or actions in relation to another client, colleague, him or herself, or some other third party. And the husband is actually the third party, right? And so I'm going to copy this for you and give you this link. I'm going to put it in the comment section. That way you can copy and paste it and use it for yourself as well. It goes into a little bit more detail about understanding conflicts of interest. Also, I love social work today, and they always have some really good articles that you can read from and learn. And so I will also copy and paste this link for further reading. I would encourage you guys to kind of just delve into that a little bit more, just so you can have an understanding. Remember, we do not study to memorize, but we study to internalize. And internalize and come with, checking into different resources, making the connections, see where this fits, see, being able to create examples and situations from the content area, and being able to put it actually in your own words. When you're able to regurgitate this information back in your own words, it has become a part of you. And then lastly, I just want to let you guys know that you can always go to, and I know you probably all have your own study prep material and all that stuff, which is great. Whatever it is that you use, continue to use that. If some of you are still looking for more, you can find questions like these and more on the social work exam website. I also write practice questions for these guys as well. So there's the web link, so you can go there. Now, last thing, just in case you didn't see the beginning of this video where I had to end it, I just want to let you guys know that God is just blessing me, and I'm going through some transitions, and I'm really excited about what's happening in my life right now. It did not come without a lot of hard work, hard work. On Tuesday, February 26th, I will be releasing my ASWB Inspirational Exam Workbook. It will be filled with strategies and ideas on taking the exam. It also come with about 20 practice questions, or maybe a little bit more. I can't remember. And so I would encourage you all and ask for your support, on the 26th. You could go ahead and purchase that workbook. You can either get print copy or e-copy. The e-copy you can use on Kindle, iBook, wherever, right? So I'll give you guys the link to that soon in the name. So just look out for it on Tuesday. And then Also, I will be starting my studies for my doctorate program. So I'm extremely excited about all the wonderful things that is happening. And just to let you guys know, you can do this. You can do this. You can slay that giant. You can go out and get what's yours. You can accomplish whatever you put your mind to. You just have to see it and believe it. You have to claim it. And please always identify your why. We cannot be taking this exam to maintain our jobs. Trust me, I understand we need jobs. We need to pay our bills and we have to earn a living. But if we're focusing on the fear of losing our job, if we do not get this license, then that anxiety and that fear is going to keep leading us and getting in the way, and panic will set in. Know who you are. Understand that you are more than capable. Know that this is a challenge. It is a very difficult exam. However, the results that will be, what will come out of you as a result of you taking this exam will only increase your level of professionalism, make you more keenly aware and understand the nature of the work that you do, and allow you to excel to different heights that you never thought imaginable. If I could tell you all, Michael has been with me over the past year and a half. I know he has. He saw where I was in the beginning, and he also see where I am right now. And if I can explain to you guys all the things that happened over the past year for me, it's just super amazing. And I give all praise, all honor, and all glory to my Lord and Savior, Jesus Christ, and I thank him for it. So I am going to sign out now. If any of you guys are looking for any one-to-one tutoring, I also offer that. You can always go to my webpage and read there. You'll find all the information that you need there on my webpage. And then from there, if you're still interested, you could just fill out the registration form and I will respond to you. I will put the link to my webpage also here. And I look forward to speaking to you all on a one-to-one basis. Enjoy your Saturday, enjoy your weekend, and thank you for taking this time out to share with me today. All right, be blessed.